Why in the world do the inside of your ears itch? This was a question that a patient of mine came in and saw, and there was way more interest about this on social media than I ever imagined because we successfully treated this patient and they posted about it on social media. And I got more DMs on this topic, and so did they, than just about anything we had seen in a long time. So today we're going to be covering some of the reasons that your ears might be itchy and how we would treat that, both with over-the-counter options and with prescription treatment options if you visit with your doctor. Now, although the skin on the inside of your ears does have some different functions, it's still just skin and can be afflicted by any of the same types of problems that you might get anywhere else on the body. So the first potential problem for itchy ears is just you can get dry skin inside there just like you could anywhere else on the body. And we're going to see a lot more potential problems with dry skin in the cooler winter months versus the hot summer months. So if your skin is just simply dry, you want to use things like hydrating ear drops. You can use clean types of oils in there. Just be careful that you're not putting in too much. Another potential cause for this is earwax buildup. Some people make a lot more earwax than others. Your ceruminous glands that make earwax are just a modified type of sweat gland, and they make a different material than sweat. But just like some people sweat more than others, some people make more earwax than others. And if that builds up, and then especially if it gets dry and crusty in there, it can poke and pinch the skin, and that can also cause irritation. Now, you shouldn't go digging at that with a Q-tip because it's more likely you're just going to push it in further. So if you do have a lot of earwax buildup, it's best to see an ear, nose, and throat doctor because they have the right kind of tools to look down in the ear and get it out safely without causing you harm or injuring the eardrum. The third potential cause that we see are allergies. So you can have contact allergies to lots of different things. So the most well-known is poison ivy. It's not likely you're getting that inside the ears, however. But if you're using other things in and around the ears, it could lead to a contact allergy. One of the most common examples is going to be an allergy to a shampoo. So sulfates in shampoos do cause contact allergies for some people. And if you're lathering up your hair, your scalp, and some of that gets in the ears and you don't rinse it out completely, that could lead to a contact allergy. Of course, earrings, if they're made of certain types of metals, could lead to contact allergy as well. The most common of these is nickel, and that's going to be seen more commonly in less expensive types of jewelry. Sometimes we call that costume jewelry. Kids are more likely to wear that kind of jewelry, and that itching, while it's not usually deeper inside the ears, is certainly something that can be present in the areas that piercings usually occur. Another one that I think a lot of people don't appreciate is the earbuds that you wear. So a lot of people now use wireless earbuds from Apple or Samsung or a number of other companies, and sometimes the metal or plastic that those are made out of could cause a contact allergy. And even if it's not a contact allergy from the plastic or the metal, another thing to consider is how do you clean your earbuds? Because if you're wiping them down with any type of cleanser and it's not getting fully removed, then you're introducing that back into your ears, and that could be another potential cause of itching inside the ears. Now, before we get to the reason that my patient came in, another potential cause are infections. Now, we don't see a ton of infections deep inside the ear. This is different than an earache, which we call otitis media, which is an infection actually behind the eardrum. But otitis externa, or an infection around the outer structures of the ear, could be a potential cause of pain, itching, or discomfort. And this is more common in people who spend a lot of time in water. So you may have heard of the term swimmer's ear, and that is a potential cause of itching, but often significant pain in and around the ear. If you have an infection, it needs to be treated with the proper topical and sometimes oral prescription medications in order to clear that up. And if an infection in this area is not treated appropriately, it could actually have pretty devastating consequences. Because of the location, it could spread to much more important structures and potentially lead to significant problems. So what was the reason that my patient came in? So the most common things that we see going inside the ear as dermatologists are going to be regular skin conditions like psoriasis and seborrheic dermatitis. Eczema is also a possibility, atopic dermatitis, but that's a little less common in this area. So I would say that personally, psoriasis and seborrheic dermatitis are the most common reasons that people come in with itching inside their ears. You may have seen psoriasis. This is a common condition that is often leading to scaly plaques on the elbows, the knees, the backside. It can affect really anywhere, but the scalp and the ears is also a really common place. And I've had a number of patients who only had psoriasis inside their ears. Typically, we're going to treat this with topical corticosteroids. So that's a cream like triamcinolone, which is just a little bit stronger than something like hydrocortisone that you might purchase over the counter. Seborrheic dermatitis is also one of the more common things that we see, and this is the medical name for dandruff. So everybody has probably experienced a little bit of dandruff, some light flaking from time to time if your scalp gets particularly dry. But in dermatology, when it gets more severe, we call it seborrheic dermatitis. The seborrheic areas of the body contain more oil glands, and we all have a little type of yeast that lives on our skin that lives off of this oil. So seborrheic dermatitis, although it often affects the scalp, it can affect the eyebrows, it can affect the face. We see men frequently who have it through their beard line, but it can get inside the ears, and sometimes, just like with psoriasis, it is only present in the ears. And that was the case for my particular patient. She had a lot of itching inside the ears. She'd been dealing with it for years, and we did two different things to treat her. So first was the use of antifungal medications. Some of these are available over the counter. That could be things like ketoconazole shampoo or lots of creams that you could purchase over the counter. And what these will do is help decrease the number of yeast that live on the skin. And then again, because of the inflammation that is present, we'll often use topical steroids here. And in this particular case, because the itching was not only in the more outer portion, but also going down, we prescribed a liquid topical steroid called fluocinolone. And this is a very mild type of steroid, and it comes in an oil. And when we use that in these areas, it does help to hydrate the skin and it decreases inflammation. Within just a few days, she was free from itching, which she hadn't been that way in years. She was elated and immediately took to social media to post about it, prompting all of the discussion that she got on her page and that was on my page as a result of reposting that story. If you are suffering from itchy ears, of course, I always recommend seeing your dermatologist to get a proper diagnosis. But over the counter, you can try things like hydrocortisone and you can try antifungal shampoos. However, if this isn't effective for you, you do need to go seek proper medical care to make sure you're not missing something potentially more concerning. To round out the skin conditions, eczema is another possibility. We also call this atopic dermatitis. And although this usually affects the front of the arms, the back of the knees, it can affect the face and sometimes just in the ears. And that can also lead to itching. And if you guessed topical steroids as a potential treatment option, you would be right. We use a lot of those in dermatology. Now, I will just make a comment that there are alternatives to topical steroids. I know some people are not a big fan of those. I really like to use them when we use them appropriately, which means we don't use too much and we don't use it for too long of a period of time, because with chronic use, if the condition has gone away, then you can start to develop side effects. Some of those steroid-free options include medications that we call topical calcineurin inhibitors. The brand names for these are going to be Protopic and Elidil, and they really do a good job to take away inflammation without the potential risks that steroids often carry. For really urgent problems or chronic problems even, I find that steroids often provide relief quicker than these types of medications, but they certainly have a role in the treatment of many types of skin disease. So in general, if you have itching inside the ears, as I said, I recommend seeing a dermatologist for the proper diagnosis and treatment plan. However, some of these things may have some improvement with over-the-counter types of options. I want to caution you about sticking any instrument down inside the ear, whether it's Q-tips or you see these devices available on social media. Some of them have a little camera in them, and I generally advise people not to use those because of the risk. If you don't know what you're doing and you go too far, too fast, it really is a sensitive area deep inside the ear, and you could cause problems. You could damage the skin, leading to more serious infections, or you could hit the eardrum, which is really going to be painful and really bad if it happens to rupture the eardrum. So those are some of the most common reasons to have itchy ears. I get the feeling that there are a lot of these really common types of questions that people want answers to. So itchy ears was just the first one that popped up on my social media feed recently. But what other strange conditions do you want to know about? Because I would love to talk about them here on the channel and give you my opinion on what it could be, and then also recommend both over-the-counter and potentially prescription treatment options. Let me know down in the comments of this video. I appreciate you guys watching. I hope this video helps somebody. Share it with someone if you think that they could benefit from it, and I'll see you guys on the next video.